Top 4 vitamins every diabetic must take. Lower blood sugar. Hey everyone, welcome back to the channel. If you're living with diabetes, you're probably used to hearing about carbs, insulin, or blood sugar monitors from your doctor. But there's something they don't talk about enough: vitamins and minerals. These powerhouse nutrients are critical for fueling your metabolism, supporting insulin function, protecting your nerves, and preventing serious complications like neuropathy or heart disease. The problem: most diabetics are running low on key nutrients and don't even know it. This silent deficiency can make you feel exhausted, worsen nerve pain, and make it harder to control your blood sugar or A1C. Today, I'm breaking down the top 4 nutrients every diabetic needs to know about. Whether you're newly diagnosed or managing diabetes long-term, this video could be a game changer. Stick around because I'll share the best foods, decadent meal ideas, and high-quality supplements to fix these deficiencies fast. Plus, I'll give you practical tips to incorporate these nutrients into your life. Let's take control of your health and dive right in. Vitamin A, the unsung hero for diabetics. Let's kick things off with vitamin A, a nutrient that's absolutely vital for diabetics, but often flies under the radar. High blood sugar and chronic inflammation disrupt your body's ability to process vitamin A, impairing its conversion into retinoic acid, the active form that your cells need. This messes with pancreatic beta cell function, reducing insulin secretion and making blood sugar control a bigger challenge. If you have kidney disease, a common complication in diabetes, your body loses vitamin A faster because damaged kidneys can't regulate it properly. Add to that fat malabsorption issues, think gut problems or low bile production, common in diabetics, and absorbing this fat-soluble vitamin becomes even harder. Certain medications like orlistat or cholestyramine can also block vitamin A uptake, leaving you deficient without clear warning signs. So what happens when vitamin A runs low? The symptoms are subtle but serious. Fertility takes a hit as vitamin A is essential for sperm production, egg development, and embryo implantation. Low levels increase miscarriage risk and tank libido by reducing testosterone and reproductive tissue health. Your nerves become more vulnerable, worsening diabetic neuropathy and slowing nerve regeneration. Kidneys suffer as vitamin A protects against oxidative damage, and a deficiency accelerates their decline. Your eyes are a major target. Low vitamin A causes night blindness, dry eyes, and a higher risk of diabetic retinopathy, a leading cause of vision loss in diabetics. The heart weakens too, since vitamin A supports heart muscle function and blood vessel elasticity, making deficiency a risk factor for hypertension and heart disease. Mood disorders like anxiety and depression can worsen as vitamin A regulates dopamine and serotonin pathways. Even weight gain becomes an issue because retinoic acid influences fat metabolism, and without it, your body stores more fat and burns less energy. Poor circulation, stiff blood vessels, and slow healing wounds are also linked to low vitamin A. Studies suggest up to 30% of diabetics have low vitamin A levels, especially those with kidney disease or chronic inflammation. At the cellular level, vitamin A acts as a gene regulator, boosting insulin sensitivity, immune function, and cellular repair. Without enough oxidative stress spikes, insulin resistance worsens, and your body's repair mechanisms slow down. Best sources: for natural sources, beef liver is unmatched, delivering 149% of the daily recommended intake per 3-ounce 85-gram serving. Cod liver oil is a powerhouse, providing 4,500 IU per tablespoon 14g. Egg yolks offer 24% per 2 large eggs, 100 gram, while butter from grass-fed cows gives 11% per tablespoon 4 grams. Wild-caught salmon provides 25% per 6-ounce 170-gram serving. For indulgent meals, try foie gras with saffron-infused cod liver sauce for over 5,000% per serving 100-gram foie gras, 14-gene cod liver oil. A Wagyu steak with bone marrow butter and egg yolk sauce delivers 500% 150-gram steak, 50-gram marrow, 2 yolks. King crab bisque with wild salmon roe packs, 200% 150-gram crab, 50-gram roe. Animal-based retinol sources absorb at 80–90%, while plant-based beta-carotene like carrots converts poorly, especially in diabetics with gut issues. Supplements: choose Carlson cod liver oil, 500 IU per teaspoon, or Thorn vitamin A, 3,000 IU per capsule for highly absorbable retinol. Avoid processed vegetable oils, high fructose corn syrup, and excessive alcohol. They deplete vitamin A stores. If you're noticing worsening night vision, dry skin, or frequent infections, a deficiency might be silently making things worse. Addressing it can improve your eyes, nerves, and overall energy. Folic acid, vitamin B9. The methylation master. Next up is folic acid, or vitamin B9, a nutrient that's critical for diabetics but often depleted. High blood sugar and medications like metformin reduce folate absorption in the intestines and increase urinary loss. Chronic inflammation and oxidative stress burn through folate faster than your body can replenish it. Kidney disease, poor diet, or gut issues make the problem worse, leading to a deficiency that goes unnoticed until symptoms hit. And trust me, those symptoms are no joke. Low folate messes with nearly every system. Fertility suffers. Folate is vital for sperm quality and egg development, and low levels increase miscarriage risk. Libido drops as folate supports nitric oxide production, which is key for circulation and arousal. Nerves take a hit, leading to numbness, tingling, and worsening diabetic neuropathy. Kidneys, already stressed in diabetes, decline faster because folate regulates homocysteine, an amino acid that damages kidney tissue when elevated. Your eyes face a higher risk of diabetic retinopathy due to increased oxidative stress in retinal cells. The heart is at serious risk. High homocysteine hardens arteries, raising blood pressure and the chance of stroke or heart attack. Mood swings, anxiety, and depression worsen, as folate is essential for serotonin and dopamine production. Weight management becomes harder since folate influences metabolism, and a deficiency can lead to fat storage. Studies show up to 40% of diabetics have low folate, especially those on metformin or with kidney issues. At the cellular level, folate drives methylation, a process critical for DNA repair, detoxification, and gene expression. In diabetics, faulty methylation fuels inflammation, poor nerve function, and faster cellular aging. Folate also supports red blood cell production, preventing anemia, which is common in diabetics with kidney disease. Best sources: beef liver delivers 54% of the daily intake per 3-ounce 85g serving. Spinach provides 33% per cooked cup. 180 gram asparagus offers 22% per cup. 180 gram avocados give 20% per fruit. 200 gram, and lentils pack an impressive 90% per cooked cup. 198 gram. For luxury dishes, try foie gras with truffle-infused lentil puree. 150% per 100 gram foie gras. 150 gram lentils. Wagyu beef liver pate with avocado mousse delivers 120% 80 corner liver, 100 gram avocado. A spinach and asparagus souffle with Gruyere cheese gives 100% 200 gram spinach, 150 gram asparagus. Animal sources are highly absorbable, while cooking plant sources boosts folate release. Supplements opt for methylfolate 5-MTHF over synthetic folic acid for better absorption. Try Thorn 5-MTHF 1 milliliter per capsule, or Pure Encapsulations folate 5-MTHF 400 ml per capsule. Doses of 400 C to 1 milligram daily are typical, but those with kidney disease or high homocysteine may need more. Avoid alcohol, processed grains, and excessive coffee. They block absorption. If you're dealing with low-energy mood swings or worsening nerve pain, folate could be the missing link. Addressing it can make a massive difference in how you feel. Iron, the oxygen powerhouse. Now let's talk about iron, a mineral so critical for diabetics that leaving it out would be a disservice. Iron deficiency is common due to chronic inflammation, which triggers hepcidin overproduction, blocking iron absorption in the gut. Kidney disease reduces erythropoietin, a hormone needed for red blood cell production, making things worse. Metformin interferes with iron uptake, and frequent blood sugar spikes damage red blood cells, increasing iron loss. Gastrointestinal issues like low stomach acid or gut inflammation, common in diabetics, further limit absorption. Poor diet only compounds the problem. When iron levels drop, the symptoms are hard to ignore. Fatigue hits first, followed by dizziness, pale skin, cold hands and feet, and headaches. Fertility takes a hit. Low iron disrupts ovulation in women and lowers sperm count in men. Libido suffers as iron oxygenates tissues, including those involved in arousal. Neuropathy worsens with tingling, numbness, or restless legs. Kidneys face renal hypoxia, damaging nephrons faster. Your eyes are at risk as iron supports retinal health, and deficiency can worsen diabetic retinopathy. The heart works overtime, leading to tachycardia, arrhythmias, or even heart failure in severe cases. Anxiety and depression spike as iron is crucial for dopamine and serotonin production. Metabolism slows, making weight management harder, since iron supports mitochondrial energy production. Up to 30% of diabetics have iron deficiency, especially those with kidney disease or on metformin. Iron is essential for hemoglobin, which carries oxygen to tissues. Without enough, cells suffocate, leading to fatigue, cognitive decline, and slow wound healing. Iron also fuels cytochrome enzymes in mitochondria, so low levels tank energy production, leaving you foggy and weak. Best sources: beef liver delivers 36% of the daily intake per 3-ounce 85-gram serving. Oysters provide 44% per 3-ounce 85-gram. Sardines offer 34% per can 1992. And grass-fed beef gives 22% per 3-ounce 85-gram. Spinach supplies 20% per cooked cup 180 grams, but plant-based iron is less bioavailable due to oxalates. For luxury meals, try foie gras with oyster reduction, 100% per 100 gram foie gras, 85-gram oysters. Wagyu steak with sautéed spinach and bone marrow sauce delivers 80% 150-gram steak, 100-gram spinach, 50-gram marrow. A Mediterranean sardine and lentil stew with saffron packs, 75% 150-gram sardines, 200-gram lentils. Pair plant sources with vitamin C like lemon juice to boost absorption. Supplements. Ferrous bisglycinate is highly absorbable. Try Thorn Iron. Bisglycinate 20 mg per capsule or pure encapsulations. Iron C 15 mg with vitamin C. Avoid dairy, coffee, or tea which block uptake. If fatigue, brain fog, or worsening neuropathy are dragging you down, low iron might be the culprit. Fixing it can be a game changer. Vitamin B12, the nerve and energy booster. Last but not least, vitamin B12, a nutrient that's a massive issue for diabetics, especially those on metformin, which blocks absorption by interfering with calcium-dependent transport in the gut. High blood sugar damages the stomach lining, reducing intrinsic factor, a protein needed for B12 uptake. Kidney disease increases loss through urine and gut issues like low stomach acid H. Pylori infections or poor microbiome health make absorption even harder. Since B12 is only found in animal foods, vegans or those with poor diets are at high risk. Deficiency creeps up slowly, but the consequences are serious. Low B12 hits multiple systems. Fatigue, memory problems, and dizziness are early signs. Fertility suffers. B12 is crucial for sperm motility and egg health, and low levels increase miscarriage risk. Libido drops due to poor oxygenation from reduced red blood cells. Neuropathy worsens with numbness, tingling, or burning sensations.